How to prepare yourself for natural childbirth. Natural childbirth used to be the only way to give birth. Natural childbirth is the delivery of a baby with minimal drug or surgical intervention. This means that the mother giving birth avoids common medicine, such as anesthesia, an epidural, and episiotomy, which is an incision that increases the size of the vagina or birth canal, and pain relievers. Natural childbirth can occur at home, in a birthing center, or in some hospital birthing centers. Often, natural childbirths are facilitated by other women called midwives. Whether you decide to have your child at home, in a birthing center, or a hospital, there are some things you can do to get ready to have natural childbirth. Method 1: Finding the right people. 1. Decide who you want to help with your delivery. Before you give birth, you need to decide who you want to help you with the delivery. You can choose a physician that specializes in births, called an obstetrician, a family medicine doctor, or you can choose a midwife. All are professionals who have experience with childbirth. Make sure you choose an obstetrician, physician, or midwife who is comfortable with natural childbirth and who will listen to your wishes. Set up interviews to talk to a few of each to determine who seems like your best choice. Ask about his or her experience, by whom he or she is certified, and what he or she would do under emergency circumstances. Midwives often have professional relationships with hospitals and with obstetricians, so the majority of them are safe and will have your best interest in mind. If a midwife decides that either you or your baby would be better served in a hospital setting, she will let you know. If you are looking for a midwife, try the online database run by the American College of Nurse Midwives. 2. Find a birth coach. You also need to find a birth coach. Oftentimes this will be your partner, husband, or wife, but it can be a friend or relative such as your mom or your sister. Make sure whomever you choose makes you comfortable and will be able to support you during the hard road to childbirth. You may also want to make sure the birthing coach has the same views about your natural childbirth as possible. 3. Look for a doula. In addition to a birthing coach, or instead of, look into finding a doula, a labor and delivery coach that will stay with you before, during, and directly after the delivery. To find the right doula for you, ask your obstetrician, midwife, local birthing center representatives, friends, family, or other expectant mothers for recommendations. Once you find a few recommendations, meet with each of the doulas, see if she or he meets your criteria for a labor coach, and make sure you get along. You can also find a doula through an international search on the DONA International website, the oldest association of doulas in the world. 4. Ask others about natural childbirth. To understand more about what will happen during natural childbirth, do some research. Talk to new moms, check out pregnancy support groups, and talk to birthing educators. This will help quiet your fears and give you vital resources to turn to when you have questions about your delivery as it approaches. The people you talk to may also have recommendations of good doctors or midwives who are experienced in natural childbirth. Method 2: Getting ready. 1. Find birthing classes. As you prepare for natural childbirth, you need to look for birthing classes that will teach you ways to deal with the pain and discomfort you may be facing. Your obstetrician, midwife, or doula can help you find the best classes. There are many different kinds you can try. Lamaze classes have been helping women through natural childbirth for many decades. Lamaze uses breathing, relaxation, and focusing techniques to aid in childbirth. The Alexander technique teaches coping methods for the pain and discomfort associated with labor using methods of flexibility, balance, coordination, and movement. HypnoBirthing takes both the physical and psychological aspects of birthing and pays special attention to relaxation, breathing techniques, meditative practices, visualization, exercise, and nutrition. The Bradley method emphasizes involvement of the whole family and teaches various techniques to improve the delivery experience, including breathing and relaxation. Acupuncture and acupressure can help reduce the pain and discomfort during labor and delivery. Birthing from within is a method that regards childbirth as something experienced by all women and sees it as a transformational process incorporating physical, mental, emotional, and spiritual components. Prenatal yoga helps you increase the strength, flexibility, and endurance of the muscles you will use during childbirth and also reduces your risk of preterm labor and pregnancy-induced hypertension. 2. Practice your techniques. Practice the breathing techniques and the relaxation techniques taught at your birthing class. Work with your coach and your doula so that you are very familiar and very comfortable with these techniques and know how to use them when the time comes. Make sure you practice with your birthing coach. This will ensure that your coach is also comfortable and familiar with his or her role in the birthing process. 3. Learn pain management techniques. Since you will be having your baby without medical intervention, you should learn about alternative pain management techniques not related to birthing classes. These additional methods include water birthing, a technique that is supposed to put less stress on the mother and child, or taking a warm bath during early labor. Applying a warm or cold compress or hot water bottle on areas of discomfort. Changing position, walking around, or sitting on an exercise ball to relieve the tension. Massages, especially to the feet and back. Listening to music. Visualizing the contractions before they happen to prepare yourself for the pain. Imagining yourself somewhere else without pain during the labor. Method 3. Writing your birthing plan. 1. Start with an outline. As you start your birthing plan, you need to have a general outline of what you want to do. Your birth plan should outline what you want to have happen around the time you give birth. This will help you keep track and will also help your obstetrician or midwife and your birth coach to provide you with the experience you want. 2. Pick where you want to deliver. There are 3 options to where you can give birth. You can give birth at home, to ensure that you have a natural birth. You can also choose a birthing center. Your home or a birthing center will likely provide more family-centered experiences, and you may have more freedom in creating the natural birthing experience you want. The third choice is a hospital, which is always the safest place in case of unexpected problems. More and more hospitals are providing birthing centers that are comfortable and homey. If you choose a hospital, make sure you have a clear plan that has been relayed to your obstetrician or midwife. 3. Choose how you want to deliver. If you want a drug-free and natural delivery, you need to let everyone know that is your plan. You may also choose to have a water birth, which is a method that occurs while in the water. It is thought that it is less stressful for a baby to leave the amniotic fluid-filled uterus into a water-filled tub. Water isn't always recommended. For example, it is not recommended for premature labor, breech birth, or multiple births. Remember, labor is called labor for a reason. However, most women who have a natural birth say that the pain and discomfort is worth it, especially once they can hold their newborn baby. Expect some pain and discomfort, but the levels vary for each new mom. Choose how you want to deliver your baby. Different options vary in different locations, so you will need to see what is available in your area. Again, talking to your obstetrician, midwife, or doula can provide invaluable information. 4. Understand possible complications. Although home births are great for natural childbirth, there are some things you need to take into consideration. There are a few reasons why medical or surgical intervention may be needed to ensure safety for both you and your baby. These may occur after all the planning for a natural birth, so you want to make sure you understand and have a backup plan in place. Under certain circumstances, your obstetrician or midwife may need to send you for an emergency C-section or perform other interventions. These circumstances, which may happen rapidly and unexpectedly, include: if the umbilical cord is being compressed, cutting off blood flow to the baby. If the baby is not positioned correctly for delivery. If you are carrying 2 or more babies. If your baby is too large to pass through the birth canal, macrosomia. If the placenta is not positioned normally, placenta previa or placenta accreta. If a fetal heart rate monitor detects any sign of fetal distress. If there is a tear in the placenta, which can cause significant bleeding.